is related to COVID-19 versus other subjects, something that came up this morning.
Thank you. Good afternoon. For the
And we need,
slides.
we
Yeah.
need slides. You don't really need slides, do you?
So it's not sharing yet.
Not yet, right? There you go. You're on.
Oh, yeah. So thank you for having us here. So I'm going to present you the results of our research comparison of updates to liver systematic reviews related to COVID-19 versus other subjects. This research was held by Gustavo, my PhD student, Marcos, which is a professor at the University of Sorocaba, and myself, that I am a professor at the University of Campinas, the three of us from Brazil. We have no conflicts of interest to declare, and also this research was not funded. So living systematic reviews are systematic reviews, which are a synthesis of the evidence that are done in a transparent and reproducible way their intention is to be constantly updated to incorporate new evidence once it becomes available. So the living systematic reviews are particularly useful in areas in which research is rapidly evolving, just like we saw in the COVID pandemic. So the aim of this study was to assess the frequency of updates to living systematic reviews and the COVID-19 influence on these updates. So what we did, we set up a cohort study. To start our cohort, we did a research on PubMed on September 2021. And in this search, we searched for living systematic reviews that were published up to December 2020. And then on January 2022, this year, we did this search again. And then this time we searched for living systematic reviews published up to December 2021. So this was the end of the follow-up of the cohort. So our unit of analysis was the original version of the living systematic review retrieved. We did not include other papers that could have other results or that would not be the living systematic review per se, just like the protocols, conceptual papers, and any other type of research that it could use the secondary data from the living systematic review. From this initial cohort, then we searched for the journal's citation report of 2020 of the journal that the living systematic review was published. We also checked the open access status of the manuscript. So it was not the open access status of the journal, but if that living systematic review was open or not. And then we compiled the information in an Excel file. We did a Kaplan-Meier survival analysis in which we assessed the number of months from publication of the original living systematic review to its first update or the end of our cohort. And then we stratified by the subject, either COVID-19 or not. And we also did a regression analysis with Cox proportional hazard models to calculate the hazard ratios with 95% confidence interval, and we adjusted by the journal impact factor and the open access status to adjust for confounding. And our analyses were performed at Stata 14. Okay, so our results. So we retrieved 104 records. Half of them were excluded. 10 were conceptual papers, 14 were protocols of the living systematic reviews, 28 were studies that were using data from the secondary data from the living systematic review, and we included 52 living systematic reviews. So the main characteristics of these 52. The 32 were published in 2020. 28 had COVID-19 as subject, so over a half of them, and 50, almost all of these Libby systematic reviews papers had an open access status, were freely available. Oh, here. And regarding update, 60%, so 31 from 62, the 60 to 52 Libby systematic reviews were updated until our follow-up, until December 2021. And it took, on average, 14 months with a standard deviation of 3 months to the first update of this Libby systematic review. And 21 Libby systematic reviews were never updated, and on average, after 25 months from publication until the end of our follow-up. Regarding the subject, we saw that if the Libby systematic review was about COVID-19, it would be updated on average in 9 months. As I mentioned, there were 28 Libby systematic review with this characteristic. And about other subjects, the time would be higher in 30 months on average, and there were 24 Libby systematic reviews. So here we show the time to the first update of the Libby systematic review since the original publication according to the subject. So this follow-up was until the first update or the end of our follow-up. So here we see the cumulative incidence of Libby systematic review first update or the end of our follow-up. And then we see that if the Libby systematic review was about COVID-19, the time for being updated was much shorter than compared to other subjects. So this in our Kaplan-Meier survival analysis. About the likelihood to be updated, about the factors that we investigated, we saw that the likelihood of Libby systematic reviews to be updated was much more higher if the COVID-19 was a subject, so the hazard ratio was 3.64. And also, if the Libby systematic review was published in journal with higher impact factor, which also had a higher likelihood to be updated faster over time. And the open access status did not influence, but you remember I mentioned 50 of the 52 were published, were available as open access, so it did not, almost all of them had this characteristic. So what we see, first conclusion that our team got is that we got a little bit surprised about the number of Libby systematic reviews. So the methods for Libby systematic reviews were evolved and published on the about 10 years ago. A decade ago. So we see that it's a limited number of Libby systematic review. Of course, we used just one source, which was PubMed, but is the in health science, in health field, is the main database, bibliometric database. So this is the first impression that we got. So there is just a limited number of Libby systematic review, 52. And 60% of them were updated in about 1 year. About 24 of these Libby systematic reviews were never updated, despite having been published on average of 2 years that we found, of 25 months on average. And the COVID pandemic and its resulting research potentially favored more updated of Libby systematic reviews, mainly because of available research, and also Libby systematic reviews that were published in high impact journal were more likely to be updated. And as we see that there is a limited result of Libby systematic review, and that the justification for doing this kind of research would be that the field needs constantly update, future research may investigate the reasons involved in living systematic review that were never updated over time. If there was no research at all available, and then perhaps the choosing to perform a living systematic review was not the case, or because there was lack of funding or lack of other logistics in the field that prevented the authors, the team, to perform the update of the living systematic review. And then I'll set up here, and I'll be glad to get your comments and thoughts. Thank you.
Very fast questioner, please.
Yes, Les Citrom, Current Medical Research and Opinion. So I'm fascinated by the living nature of these systematic reviews and that they would get updated frequently, which is great. Now, I'm curious though, how were they updated? Was it adding new material or deleting retracted material or both?
Yeah, some depends of the policy of the journal. Usually, it's the first living systematic review stays published, and then they would indicate where the other result is available, like in another GOI, or as Cochrane does, it substitutes the newer. The older is substituted by the newer.
Thanks. Back there.
Yeah, thanks. Lovely research. Malcolm MacLeod, University of Edinburgh. So there's a lot of dead parrots here, and things are certain to be living reviews when they're not. But I hesitate to say it in this audience, but perhaps journal publication isn't the most efficient way of communicating the results of a living review. So for those that had not been updated, did you look and see if they had any kind of online representation of their continuing livingness, or were they just dead?
Oh, we just focused on this available data from PubMed, but but usually they would say in the paper where it would be available, and then we would search for it.
And did you just say journals weren't good in front of an audience of all journal editors? Just wanted to.
Yeah, well, I think time will tell.
Back in the back.
Michael Mullins from Washington University in St. Louis. What proportion, if any, of the reviews that had an update resulted in a change in conclusion or recommendation?
Oh, we did not check this. But usually when we see the theory regarding this, so depending of the number of usually those are based on clinical trials in the health area. So depending of the number of clinical trials studies that were included in the first original systematic review, the results may not change. So, but in our research, we did not check if it eventually changed the result or just confirmed it. But from other previous research, what we see is that together with network meta-analysis, living systematic reviews are expected, their results are expected to be confirmed, and then to bring upfront results with more credibility.
Thank you.
Mhm.
Virtual, then up here.
Gerben Turriet of Amsterdam University wants to drill down on part of Dr. Citrom's question. To what extent did the living systematic reviews update because of retractions, or to what extent were they susceptible to including retracted articles without an update?
I think the same level that a regular systematic review, but we did not check this in our database. Yeah, but it's an interesting follow-up that we can do.
You're then there.
Hi, Robert Thibault from Stanford University. I'm wondering if between the original version and updated versions, if the authors ever change at all, because one way I would think of living systematic reviews getting updated more often is if they're designed in such a way that somebody else could easily take the lead and move that along. But
Yeah.
that may go beyond what you did.
Yeah, this is also very interesting to be explored, but we did not check this, but for sure it's something that's feasible and as justifiable, as you mentioned, because it's another workload.
Front and back.
Lovely presentation.
Thank you.
I'm Martha from the US CDC, and I just wanted to also capitalize on a previous comment, which is that in living systematic reviews, perhaps their format isn't necessarily articles all the time. Because I saw a lot more living systematic reviews for COVID living instead in other formats like Magic App or Dynamed's doing interesting things as well. Instead, I think we have to do some soul searching in publishing. I'd love to hear more discussion on it. But how often does it have to be updated as an article to count as a living systematic review? And how many of those articles come out, especially because especially with our inaugural address, we were saying how retractions happen and you have to flag a data or a preprint or an article. It should flag it all the way to a living systematic review. If it lives in another format, it can more easily and rapidly change, which for emergencies is really important. Also, just thinking on, for emergencies, we're trying to affect health in real ways. So being in a format that can be integrated into electronic health records might be more available than an article as well. Also, I think I understand why the subset was small. You might need a proximity search when you're searching in PubMed using in Medline instead, because a lot of living systematic reviews say living COVID systematic review. So if you did in quotes, it will unfortunately limit it out.
Yeah.
But I would love to discuss further.
Yeah, great insights. I agree with you. So perhaps this is the first approach and then should be further explored.
Back there, then again up here.
Thank you very much. That was a terrific talk. COVID was sort of unique, at least for some of us, because early on there were case series and the early systematic reviews were actually aggregates of case series. And there was a substantial concern about duplication of patients because if a patient had more than one attribute, a congenital disease and an acute problem, they could come up in more than one case series and with amplification and misdirection. How does your approach help that? Or do the updates ever look for duplication of patients? Or is there any way to address that flaw?
Usually systematic reviews are very careful about duplication of studies. And then these kind of researchers are especially trained and reminded to be aware that a study is different from a publication. So perhaps we did not explore if duplications were happening, but the field is very aware about the distinction between studies and publications, different publications.
Thank you. 2 questions up here.
So it's more a comment and to illustrate what was said before. Isabelle Boutron, Université Paris-Cité. So our group, which is also a Cochrane group, the COVID Anemia Initiative, decided not to go through publications, but to set up a platform where we did put all the data, updated weekly, all the review, and it's only later that we publish the results. And actually the publication was outdated out as soon as it was published, but it was linked to the platform to transmit the results.
Great, thank you.
Please.
Great presentation. I'm Nelson from Brazil, so it's nice to see Brazilian friends here. So can you conclude that COVID-19 was a subject associated with a higher probability of updating these living systematic reviews? Because when seeing the survival, the cumulative incidence, it seems like the other subjects, they come higher, but it takes longer.
Yeah.
But because of hazard ratio, maybe because COVID-19 comes faster,
Yes.
it waits more. Like
Yeah, but this that you mentioned that continues because at the end of our follow-up. So because we censored over there, so we finished following them, but they up to then they were never updated. So that's why.
okay, thank you.
And let's close it out with virtual question.
Follow-up question from Philip Kapp at Amsterdam University. Did you look at funding, the presence or absence or the source of funding? Did that have any relationship with whether the LSRs were updated or not?
Oh, this is a great question. So we can further explore in our database. For sure, it should give us another insights. If that's one of the things I mentioned the conclusion, because why were these never updated? So was there any logistics that the first project, there was substantial interest to keep updating and then by the end of 2 years or more, it was never updated. So thank you, and then we can explore this further. Mhm.